guys, it's Abby here at Care for Health. I just thought I'd make this short video about the difference between tennis elbow and golfer's elbow. So it's not just tennis players and golfers that can suffer from these injuries, anyone can suffer from these. So they are both overuse injuries, which are caused by activities that require repetitive motion of the arm and the wrist. So the difference between the two is based on whereabouts in the elbow it's inflamed. So both tennis and golfer's elbow involves epicondylitis, which is the inflammation of the tendon within the elbow. So for tennis elbow, it is lateral epicondylitis, which is the inflammation of the tendon on the outside of the elbow. And then for golfer's elbow, it is medial epicondylitis, which affects the tendon on the inside of the elbow here. Okay, so now I'll just talk to you a little bit more about the difference between the two. So with tennis elbow, this can affect, it's most commonly affecting people between the ages of 30 and 50. It's often caused because the muscles are overworked and become inflamed. And as well as tennis players, it can affect anyone from like carpenters, plumbers, anyone who has a job which requires repetitive movements. They can suffer from this. So it isn't just tennis players and racket sports that you can suffer from tennis elbow with. And then some of the symptoms which are very common with tennis elbow includes pain radiating down the outside of the elbow and into the forearm, and this can sometimes be a constant ache, or it can be painful when performing specific movements such as reaching, grasping, lifting things, and it can also radiate down into the wrist as well. And as for golfer's elbow, it's often caused by the repeated twisting or flexing of the wrist, and this is due to the overuse of the forearm muscles. So as well as golfers, a lot of people that suffer from golfer's elbow include gardeners, anyone using a shovel, even tennis players can suffer from this, and anything with repeated lifting. So some symptoms include pain on the inside of the elbow when lifting, and in the wrist and the hand as well, pain when twisting the forearm and making a fist, and it may be swollen or tender to touch. If the symptoms do occur for more than a few weeks, stiffness may occur in the elbow, and then a weakness in the hand and the wrist may also occur. So if you feel you're suffering from any of these conditions, or even any of these symptoms for either tennis elbow or golfer's elbow, or another issue within your arm, please feel free to get in contact with us, and we can get you booked in with Adam or myself for an appointment to see what's going on, and we can go over some exercises and treatments specific to the injury. Thanks again.